Welcome to the Superhumanized podcast. I'm your host, Ariana Summer, and today we open a field of inquiry and healing around women's mental health, reclaiming wholeness, and reshaping the way we understand treatment, addiction, and embodiment. Our guest is Dr. Stacy Cohen, a double board certified psychiatrist, addiction specialist, and founder of The Moment Health, a revolutionary holistic health and wellness clinic that integrates science, soul, and social impact. What drew me to Dr. Cohen's work is not only her clinical depth, but her fiercely compassionate, women centered lens, a lens that acknowledges that mental health and also addiction looks different in women, that healing must honor biology and story, and that reclaiming joy, clarity, and inner coherence is a personal, political, and spiritual act. As someone who has walked this path of healing myself, I know the power of what happens when we shift from symptom management to soul based medicine. This conversation is not merely about treatment, it is about remembering what wholeness feels like and choosing it again.
Superhumanize. Accelerated evolution.
Stacy, welcome to the Superhumanized podcast. It is really great to connect with you.
Thank you so much for having me. I'm really honored to be here.
Absolutely. When I learned about your work, it really resonated with me. You founded the Moment Health in response to what you called the fragmentation of mental health care. Can you tell us more about what that fragmentation looks like from the inside of the system and also what inspired you to create a new model that breaks that paradigm?
Yeah, absolutely. So I had been working in LA as an addiction psychiatrist, and I had actually started in surgery, so it was like a whirlwind career. Switched to psychiatry, maybe more on that later if there's time, maybe not. And I worked in a few different capacities early on, both in treatment centers for addiction treatment, because that was my specialty, as well as a community clinic that primarily served the homeless, as well as a solo private practice. And I felt quite strongly that unless you were in a residential community or even the facilities that treated the homeless, they had teams. But I felt quite strongly that people that were coming for help in the outpatient space were missing that team-based collaborative approach. And a lot of the people I saw had some semblance of a team, but they weren't communicating with each other. They weren't working together. They weren't working in community. And so that interdependence that we need and that serves us just didn't exist in the outpatient space. And so I started noticing like my patients would be gathering in the waiting room, and some of them knew each other from AA meetings, or at first I was treating primarily people in recovery. And they'd be like looking for a place to hang out, and they'd be sharing each other's acupuncturist or therapist or other things they were doing. And I was like, we really need a more collective space. I can't do everything myself, nor do I want to. And there's practitioners that do things that I can't, and vice versa. And if we don't talk to each other, sometimes we're hurting the patient. Their patients getting meds they shouldn't be getting, or getting a therapy that's maybe counterproductive to what they're working through. So it felt to me that team-based approach that happens in the hospital, in a surgical room, or that happens in a residential facility, or even some of these homeless health clinics that have outreach teams, et cetera, case managers, really needed to exist in the private practice realm in order to give people the best care. So that's how I decided to have a collaborative model. I wish we could do so much more than we do, but I also say we don't need to do everything. There's people out there doing things, and everyone's become very subspecialized. So I see the moment as primary care of mental health, in the sense that it's across the lifespan, and we service all mental health related specialties. But certainly if there's nuanced issues that people have, we may very well refer them out to get that help. And the name came from, frankly, the one thing I was doing back then for I shouldn't say the one thing, I exercise, I saw friends, et cetera. But I would take my breaks from my work and go get massages at a place called The Now. And when I decided to open the group practice, because I had been solo for many years, I wanted something that reminded me to be present. And so I thought of the moment after being immersed in the now and thought this is being in the moment, being present is such a key to mental health. It pulls all the strings together. And also that sort of aha moment that happens for people is something I also hope that we can achieve, which I know I've listened to some of your podcasts, Psychedelics and other things help people do. But so the moment has a duality of meanings. That's a critical moment of change and also the presence that keeps us healthy.
Outstanding, Stacy. And we spoke about it before we hit record. You also just mentioned it in my own work at one of our companies that's called Gateway Sciences. So we have a clinic called Gateway Clinic in Santa Monica. We also try to weave biotech, psychedelic therapy, ketamine in that case, and holistic support under one roof. And I'd like to learn from your experience what you believe is essential for such a multidimensional care model as you also have to actually work, not just in theory, but in practice?
That's a great question. So ours is more clinically focused, I would say. So we're more psychotherapists, drug and alcohol counselors, ketamine, TMS, psychiatry. So we're not doing all the stuff in the wellness space per se, and there's room for everybody. And I like your question because I think it's so important because I think so many people are being the one-stop shop for mental health these days. And so what makes it work, in my opinion, is the health of the team. So I think we live in a world where interdependence is critical. And everybody on my team, I'd say every clinician's been there since the beginning, and our administrative team has grown with the company. And the reason we have is because we water each other. We water ourselves. We take care of ourselves. I was telling you, I just came back from 2 weeks really off for the first time. That was really just for me in a long time, and it was much needed. We have meetings every single week where we do mindfulness exercise, we do check-ins, good and bad, sparkle one another. And then we discuss the cases that need some extra attention or TLC, or that maybe we feel we need attention because this is a difficult case for us to work through. So we're really there for one another. We have community events with one another and the community, and we support each other in taking the space we need to grow, because I don't believe that I know more than other people. I'm a student of myself. I'm a student of mental health. I'm a student of the world, and we all need to be learning. And so we bring in one another or even experts from the outside to teach us and to learn together so we can really hold a space that we all feel held in addition to the space we're holding for the patients.
Beautiful. Yes. And the core is really a healthy team and supporting each other. And especially in that realm, let's just use the umbrella term, healers also need healing and also need space holding. Another thing that really stood out to me about your work is, Stacy, that you've spoken about how addiction looks different in women. Could you unpack that a little for our audience, especially how, with regard to how culture, hormones, and socialization can create different pathways into and also out of addictive
Absolutely.
patterns?
And I want to start by saying that I think in general, when it comes to our mental health, and I don't think it's mind, body, soul, spirit, it's not just mental health, but the answers to it are usually comprised of a bunch of different puzzle pieces for anyone, man, woman, dog, whoever. But certainly I don't know much about dogs, but man, woman, or trans or whatever you are, it's a puzzle, and it could take a lifetime to put the pieces together. And it's really a process of work, but we want to, of course, find the puzzle pieces that fit so that we can unlock more magic in our lives, more meaning in our lives, more healing in the world and amongst each other. But I do think in particular, women, because of a million reasons we don't have to get into here, we haven't necessarily been researched or attended to as properly as we need to be, I'll say. And there's many reasons why, one of which is just we haven't been available to, or tending to young children, for example, and can't necessarily show up for a study, or in the olden days weren't working as much. Now we're trying to wear every hat and do everything, which may create a whole new set of issues. But that said, things like hormones, for example, not touched in psychiatric residency or training whatsoever.
Mm.
The amount of maybe PMDD, premenstrual disorder, was just being talked about when I was in training, which was not that long ago, 15 years ago, 20 years ago. But there wasn't a fellowship for women's mental health back then. There were just starting to be some certifications and stuff. I did a chief year in it. But for example, menstrual cycles can cause pretty serious mood disorders for a good chunk of a woman's life, and they oftentimes get ignored. Other gynecological issues like endometriosis, PCOS. I'm interested also, having been a surgeon, I did see a lot of bowel related issues. I saw a lot of gynecological related issues that then caused mental health issues that just were not taught, not discussed. Puberty's happening younger now for a multitude of reasons. Stress may be a big part of it. And then perimenopause. Perimenopause is this huge topic that's like blowing up in all these large internet-based medical companies. But the reality is that the physicians that get for the most training, which we're really lucky to be supported by nurse practitioners and physicians assistants because we have a huge shortage. But if you look at psychiatrists, which there's already a shortage, there's an expected shortage coming up. We get the longest amount of training in mood and mental health, and we are not taught about perimenopause and what to do in perimenopause. Maybe a day or two of our training. It's wild to me. Postpartum depression, which is a huge problem. It's devastating, not really discussed. So I believe that when we are treating women, we're treating everyone, but we're really treating the whole body. And when it comes to women, hormones, thyroid issues, which are more common in women, the perimenopausal drops in estrogen, et cetera, those things must be considered. Sleep-related hormones must be considered. So sometimes we're using medications for that. Sometimes it's lifestyle modifications, stress reduction. Sometimes it's actually just mindset. Like I tell patients that it's okay that they have their lazy week the week before their period. It's okay that people used to sit in a red tent. There used to be ceremonies. Like, why don't we make that the week we have our massage and eat the things that that maybe we don't want to eat on the other times, or maybe we don't go to the gym 5 times that week. So some of it is listening to our cycles and our rhythms and really allowing ourselves to have space for what our amazing bodies need to do to be healthy. So
Yes, indeed, Stacy. And it boggles my mind what you said, that there is so little time spent looking at hormones or at menopause and things like that. Perimenopause, which a lot of women can be in for 10 years, sometimes even 15 years. In your experience, how does perimenopause and then also menopause shift the mental health landscape for many women? And are there maybe some stories or insights from your practice that illuminate how we could maybe begin to reframe these transitional times?
yeah, it's a good question. So right now, I'm very excited about duality. Let me explain. I went to a conference about psychogenic pain. So it's all about how pain lives in our body and how the mind and body are so connected, and how we can oftentimes actually use psychological approaches to treat physical pain. And one of the lectures was on perimenopause, menopause, women's health. And they presented some data that was just mind-boggling. There are societies in which menopause is not, where aging is not deemed a negative thing for women. And in those societies, the menopause symptoms don't even exist. There aren't even words for it. The only symptom that exists is the hot flashes. But those are easily treated with a beta blocker. It's not a big deal. And that's it. And it's almost like an honorable sign of aging. But the mood swings and the dryness and the sexual side effects and all the other skin changes, none of that is even diagnosed, recognized, discussed as a symptom. And then you're over here in America, where there's a massive industry driven by private equity, medicine, blah, 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 which is happening all over, where like you can go online and type in perimenopause, and there's 10 different places you can book an appointment in 2 seconds and get 10 different medications. And so when I speak of duality, I think that the reality is we are like now very excited and jumping in and doing a million things for it. Whereas I think probably the answer lies somewhere in the middle of let's make space for it. Let's make space to tend to it. Maybe somebody over here needs that little puzzle piece of a little bit of estrogen. Like I went through horrible postpartum depression. I did not expect it. My first 3 months after my child, I was perfect. And then I dipped so low, and no antidepressant, nothing helped me until I begged somebody to put me on an estrogen patch. I just knew. I tried things that didn't work. I just knew. I didn't try ketamine at the time. I was scared to leave my child even for 45 minutes, but probably may have helped. But I just had this feeling that like this has got to be hormonal. I've never experienced anything like this, and that's what's changed. And that was driven by intuition, frankly. Since then, we now have allopregnanolone related medications that now we can actually prescribe for postpartum. I had a patient respond in 2 days to medication for postpartum depression. I think it's really important from like a Western medicine perspective that we know these meds, we educate ourselves, we have research driven data that helps us understand how we can help people heal quickly, and that we make space and time to be intuitive. Part of why I probably had postpartum is I barely took maternity leave, barely took time to myself and my child. I had a million things going on. I was wearing 27 hats and added another one as a mom, which is the biggest hat. So, I think when I say duality, I think it's so important that we have more tools and pay attention and learn them and know how to use them. And I think sometimes it's really important to strip away the tools and get in touch with what's just naturally there and make space for that so that we can thoughtfully, slowly choose the right tools. Because I do have this fear. I saw a lot of your podcasts are focused on psychedelics, and I also treat addiction. I have this fear that all of a sudden we tell everybody thinks they can just use psychedelics for everything, and not great for young people. We saw with marijuana, there's a huge rise in hospitalizations for psychosis once marijuana was available to everyone. So to me, it's about tending to the duality of things and finding the right balance and also the right individualized treatment. And until we really listen to ourselves and make space to listen to one another and work in an interconnectedness sort of way, we are sometimes hurting ourselves with the solutions, or we're sometimes missing something from what we could be using for a solution.
I could not agree more, Stacy. There are no silver bullets, there are no blanket solutions. It's so important to really focus on a case by case instead of just prescribing something to a majority of people, whether that's an herb or whether it's ketamine assisted therapy, as an example. And I think it's really important what you pointed out as you went through postpartum depression and you just knew, you just sensed your intuition, your knowingness told you it's estrogen. I need to get on an estrogen patch. And I co-founded a women's community. It's called Ma Circle here in LA. We've been regularly meeting for the last 2 years.
Oh, I
And
heard you talk about it with Dr. Zach. Was it Dr. Zach?
yes,
Yeah.
I did. Uh-huh. So we really, when we get together, we explore where our spiritual, our hormonal, our emotional lives intersect. And it has really not only given us individually better understanding and better tools, but it has also taught us that we need to listen to ourselves, right? The quiet voice that so often has been tamped down, right? That we've been taught not to listen to. And it's really had a huge impact on our well-being, whether it's mental health or physical health. And in your view, how can we better empower women to be active agents in their own healing?
Such a great point. I think the making space thing like can't be underestimated. I think that we are such busybodies. We're walking around in our workout clothes because we have to go to this doctor and pick up this kid and do this and get to Pilates in between and do all this. And I think in my 40s, like I read a book that my husband recommended I read, and it was so profound. It's called The Middle Passage by a Jungian psychoanalyst named James Hollis. And I'll brag that my husband's working on a project with him, which is like my territory, but he took it. But anyway, but I'll say that the middle passage in James Hollis's words is the second adulthood. So we go through our first adulthood when we grow up and we get on our own and we mark ourselves as independent. Maybe we get married or have kids or find our career or whatever we do. But then the second adulthood is now that we've gotten to all those places, how do we find meaning in life on life's terms? And what do we really care to make of this life and imprint in the world and in this life? And how are we going to spend the rest of life that isn't about accomplishing things or checking off a box? in the space of ourselves and the world in a way that matters. And some people don't get through that passage and get stuck. And some people really find it quite challenging, but move through and figure out what that passage is. And I forgot the question now. For me, what was the question?
So how we can actually empower women to become sovereign, to become active agents in their own healing.
Got it. Thank you. So whether younger or middle age or whatnot, but because we're talking about perimenopause and there's so many conversations, I think right now of empowering women in the workplace and executives, et cetera, I think this is the time I'll speak to in women's lives, this middle passage. So much about it is slowness and stillness, and it's the opposite of what we've done to get here. So it's like our society has pushed us so hard to get here, but there's a point in which, and I'm just going through this, I just took 2 weeks to kind of restructure how I'm working and what I'm doing. There's such a push to do. And then this, again, duality thing. If we don't then slow down and take inventory and take stock of what's important and go slow and be still, then we will be on that wheel going and going, and we will miss it. Like life's short. So I think particularly as women, because we go through these very special stages, whether or not you have children, our bodies are designed in this way that goes through cycles and fertility and whatnot. This time, especially perimenopause, when things are changing hormonally, it's really a time to be still and listen and reflect and say, what is my body telling me I need? And sometimes that's medication, and sometimes that's rest. And sometimes that's a shift in career, and sometimes it's a shift in a partner, and sometimes we just don't know, and it's just time. But I think time, stillness, and rest is something that we just don't really value enough. We have these phones and computers and things in front of our space, our faces. Nature gives us this. Nature helps us connect to this wisdom. The groups you're forming with women to be in community. So I think being in touch with ourselves, being connected with community, being in nature, it's like back to basics. I think that's the best thing we can do to really figure out the next best step. And I don't want to knock men for not doing this, but when men were leading the way in the workplace and whatnot, you can look back and look at the leaders who stopped and were still, and those have become like the timeless known leaders that we look at as incredible people. And then there's the people who just charge forward and want to do more and make more and aren't really thinking about everybody around them. And as women, we have this natural intuition to run the family and keep our homes and all that. And I think we need to be doing that, whether it be in the workplace or in our home or in our friendships or tending to the garden. And I think now that we have these positions of impact, we need to instill those feminine values into these impactful positions. And we are yin and yang. We can have a gentle power and still have power. But I think we need to embrace our duality and not forget. One more thing about women that's very interesting, because we're doing so much to empower ourselves. And like I said, I think we need to balance the doing with the being. I also think, and this might be controversial, but I'm just going to throw it out there, learning how to work with men and to listen to them and to receive what they are good at giving us and to give what we are good at giving them. I think that it's really important that we don't forget the interconnectedness with men as we move forward as women. I really think that's important. We can't do and be it all. We can do anything, but we don't have to be and do everything. And so I don't want us to tip in this other direction where we say, we don't need men, we can do everything ourselves, and forget just how important we all are. So it's a controversial view as a woman these days, but I've been learning so much about sort of the importance of all beings, of all people. And I think that I don't want to overcorrect. And I think a lot of like duality that comes that creates chaos and not harmony comes from overcorrection or fighting one side versus the other, rather than really learning how to interweave ourselves more beautifully.
Yes, Stacy, and I'm with you there. I don't think it's controversial at all. I think the healthy and sustainable shift from when we look at very dominating and misogynist systems that have suppressed and diminished the expression of the feminine, the cure for that is not the polar So the cure is a balanced masculine with a balanced feminine and flowing into each other and with each other. That, in my personal opinion, is the solution, and not turning completely away and trying to subjugate men and maligning men. There's growth on both sides, and especially there's a need for shedding old structures that were built on domination instead of elevating each other. That being said, everybody brings, let's say, if you are, if you identify as a woman or as a man, just to keep it very simple here, we all bring certain things, right? And some things may come more naturally to us than to the other. And something else that really resonated with me that you said, Stacy, was to create the space, right? And to slow down and go back to the basics. That is really crucial. So many of us forget that, especially when we have been in that doing go mode, which is classically attributed to the masculine. Now, not necessarily the male, but the masculine energy. And when we overextend ourselves there's so many things that can happen. Our adrenals burn out. There's so many things that get out of whack and out of balance. So the one side of healing is the basics, is the slowing down, is the creating space. The other side, and I like how you talked about the duality. So the other side of this is also certain things we have access to nowadays that are innovative, high tech, or medical. So for you mentioned ketamine, and while this again is not a silver bullet for everyone, it can be an extremely powerful medicine, especially when administered in a safe container and under medical supervision. So I'm curious, Stacy, what led you to begin integrating ketamine into your practice? Was there a turning point or maybe a patient experience?
Yeah, it was pre-COVID. Spravato came out as the name brand, intranasal esketamine or ketamine and proximal treatment. And so as a doctor, I practice by the rules. Don't always agree with all of them, and I'm excited to push the boundaries in the ways that I can or connect people to those who can do things differently than I can in other places. But yeah, I've been interested since the beginning of being in this field and like all the solutions that we have not yet figured out. Being a surgeon is, yes, there may be new technology and new devices, but we know every square inch of the body besides the brain, besides the mind, I should say. We know the brain, we don't know the mind so well. So we know that this cell in this heart, you change it, but we don't know so much about the mind. So when I switched to psychiatry from surgery, I was just itching for more solutions. I felt like we had 4 categories of medications. We had antidepressants, which are also the anti-anxieties. We had the sedative hypnotics or benzos, which are used for anxiety, but they're really not long-term solutions for that. They're more for panic and whatnot. We had the antipsychotics and the mood stabilizers. And that's it. And then we sometimes use things off label. In my own journeys, in my own mental health issues and journeys, and also in my patients, like there's a good chunk of people who do not respond well to medications, have side effects to medications, problems coming off, problems going on, problems not solved. Maybe it ameliorates certain symptoms, but not others. So I've been interested. I learned in a psychoanalytic training program. So psychotherapy was a big part of what I was doing, but so was movement and yoga and exercise and all these other body healing modalities. But I just felt like we didn't have enough medication. So I was the one who would always say yes to the drug reps coming. And for better, for worse, that's how we learn about medications here in this country. But we also develop a lot of them, and that's amazing. And so the Spravato rep kept coming. I think his name was Curtis, kept coming like every week. And I was always busy. And then I sat down with him finally, and I'm like, oh, wow, we have a new mechanism of action. Let's look at what NMDA does. I didn't have that tool before, and I wanted to see what it was like. So when ketamine came around, we were one of the early clinics to start using Spravato, but Spravato has its own challenges to fill and get covered and whatnot. So as soon as we felt comfortable that we could start using ketamine off-label for depression, and then tons of studies came out after that, we started. COVID created some barriers because people weren't coming into the office quite as much. But once people started coming into the office, we used it in a bunch of ways. And then I was very lucky to meet one of my colleagues who works in our practice, Dr. Beverly Reeder, who has done a ton of education related to psychedelics and has been really utilizing it for a lot longer than I had. So she's spearheaded that in our practice. And we're really more like a co-op. We each kind of come with our own charm. And so she has the tarot cards and the sage and all this stuff. And
Great.
taught me a lot of what I've learned. And I've done a lot of my own personal healing that way since. But it's actually very tricky, speaking again to duality. Being an addiction psychiatrist in LA, there aren't so many of us, and there are only a few females of us. And so I've been so interconnected to the recovery community. And I actually had a colleague friend early on that joined my practice for about 2 days. And then she left and she said, I can't work in a practice that's promoting the use of ketamine as a woman in recovery. And I said, I love you dearly. You're amazing. And you do you. And like, I'm proud that you're saying what you need to say and doing what you need to do. But for me, it's one tool and it's part of a puzzle piece for some patients. It's definitely dangerous for others. And we're only going to use it in a safe way because as an addiction psychiatrist, I'm probably a lot more fine-tuned in figuring out who's using it for the right reasons and who's dangerous for. And it can be a very challenging medication, and it's not like a fun journey all the time for people.
No. And to your point, Stacy, what we've experienced in the over 3 years that our clinic is open, and a very large part of the individuals who come to the clinic come specifically for the ketamine treatments, we have not experienced people who come back for, let's call it hits, right? They have their package of sessions. They often also work with therapists, either bring
Do you
their
do
own.
take home? Do you give them take home ketamine or no?
No, it's
Yeah.
all administered at the
Great.
clinic and it's either IV or IM. And we have, with the exception, I think, of one or two cases where it was apparent that these individuals were not seeking a particular healing, but they came for the substance. They moved from other clinics trying to get treatment at ours. But that's what our medical team is there for as well. They identified that and then realized, okay, this is not going to be beneficial for the individual, and then they would not get treated at our facility. But we have not experienced any type of addiction that people come back and be like, they really need the
Yeah,
ketamine.
interestingly, so it happens and it exists, but obviously as an addiction psychiatrist and working in treatment centers, I'm going to see it a lot more than other people. The take homes are what can be very dangerous. There's doctors around the country that are like sending it to people and for a lot of money in other states and not doing it like anything. There's dangers and there's goodness to it. And one of the things that's tricky, and this will go in a minute back to women, but AA, for example, can be, it's not supposed to be a judgy place. And like the book says that you listen to the doctors. Obviously, not all doctors are safe and healthy, but some people feel a lot of shame in needing something different than an antidepressant for the treatment of their mental health symptoms because they're in recovery, for example. And I've had working in the treatment center world, working in the recovery world, which is so strong in LA, I've had a number of people that are like, I really need to go do a mushroom or an MDMA journey. It's a calling for me, but AA is shaming. I feel like I'm being shamed by the people in AA for it. And for some people, it's been exactly what they needed. And they've been sober a long time. Or ketamine. They need ketamine for treatment-resistant depression. They've been sober a long time. They remain sober. Or as we know, it may help with cravings. It may actually help with addiction. I'm seeing Ozempic help with addiction. So I'm also seeing Ozempic help with PCOS. Another thing I just want to say before I forget, because we're talking a lot about women, I've seen women go to AA and the message that they're hearing is that they need to hand over their power because AA was started by two men with big egos, a surgeon and a businessman, and they needed to hand over their power and their egos. And that was critical for their process when they wrote the 12 steps. But for women, especially traumatized women, sometimes like AA is not the place, like handing over their power or being in a women's meeting that can digest this into a more female-friendly conversation is critical. But there is this, we have to remember that some of these modalities and some of these meds and some of these meetings were started by not women. And
Yes,
so I
they,
love that women are now trying to start things.
yeah. And to your point, this where for many men it may actually be important for their healing process to step out of the ego, to step out of the control. So many women have been basically taught to not have too much ego, to not stand too much in their power, that it's actually the opposite that's necessary for women.
Exactly.
And when we talk, what's also interesting with regard to ketamine is that there's more and more voices coming out that actually say it can be helpful. For example, when somebody is dealing with dependency on alcohol and others. And what you just spoke about also, we've experienced this with friends, Ozempic. And a friend of ours, not only did he lose weight, but, and this is was basically a functioning alcoholic. So he didn't even intend to, but he slowly got off the alcohol where he would have started to drink at 11 a.m. and then drink until, I don't know, late in the night. So now he maybe has a couple of drinks a few times a week.
It's incredible. I've seen patients where it helps with food cravings, marijuana cravings, alcohol cravings, other drug cravings. It's also helping women regulate their cycles when they have PCOS and their fertility issues and their cycles aren't right. So there's no, we can't look at, I heard Ellen Vora speaking earlier when I was preparing for this. We can't just look at like the neck up or the chin up because we gotta look at the thyroid too. There's so many parts of the body that are important, and the gut's one of them, and the mind's one of them, and we're talking about hormones being them. And now we're looking at parts of the mind that we didn't touch before with medication that are so critical. I think when these things are used properly and judiciously in the right patients, it's so transformative. And just to speak to the women power thing, like one of the visuals that's been coming up for me and some of the personal work I'm doing has been this like lioness and this roar. And I think becoming a mom and having my little cub, it's something that we were and I feel like the last 20 years of women that are now in their 40s or so were trained to do, which was so masculine, but we also weren't necessarily taught how to hold our power.
Yeah.
And so we're dealing with this duality of having this sort of masculine role of running businesses and leadership and all these things, but then not knowing how and when to use that voice. Even with my little daughter, like not knowing when to raise my voice is a big thing for me. And you have to deal with that as a boss in business. I hopefully never have to raise my voice at work. And luckily I don't have to because I have an amazing team. But there's times where we have to raise our voice, and that's okay. And there's times where we can be angry. And so all these things need space. They need space for us to tap into the emotions, to even know what they are. And then they need space to be felt and to be dealt with and to be communicated. So
Yes, absolutely. And what you just said also about I'm not a mother. I love children and I get to be an auntie to a lot of the children, whether they're babies or like my best friend's daughter just turned 18, and I really love that. What I've seen across the board is also a shift in raising children where a lot of the women that I know, they actually reconnect to a truly more ancestral model of raising children. I had the great privilege of speaking to, her name is Professor Darsha Narvaez. She has written a book and developed a model that she calls the evolved nest, where she really looks at how did we actually originally raise children? And where what is often considered normal in our culture, and even that has shifted throughout the decades. Let's say somebody who had children in the 60s and 70s may have considered it normal to beat them with a belt or wash their mouths with soap because that's what they learned from their parents, where there's a very different approach to that. Or let's say the crying out, right? It used to be normal to let children just cry and cry out, where nowadays a lot of people consider, nope, you don't do that. And so, interestingly enough, if we look at the ancient way of raising children, where I think for the first few years, a child was never without physical contact. And the biological mother, but also the allo mothers of the tribe, and not just women, but also men. So a child was always immediately responded to. In the modern culture, first of all, we have this fairly recent nuclear family model, which I think sprung forth with the Industrial Revolution, was actually not normal, that you just have, let's speak heteronormative cisgender mommy, daddy, and they raise the children, and mainly it's the mom. But it used to, the saying, it takes a village to raise a child. And so you have so much more stress on modern women who often, on top of being mothers, which that's a full-time job, so to speak, alone, they also have other callings, other things that they do. They may also be breadwinners for the family. So it makes sense. That's way too much. And that then things get triggered because people are just overwhelmed. But I see there's so much beauty springing up where women and also their partners are turning back to the more traditional ancestral way of raising children. And there's so much emotional regulation happening there. I'm just wowed. I'm like, wow. And I love my parents and they did a great job and the best with what they could. And also, wow, if I would be a mother, I really like what the examples of what I see, what different
Yeah,
people,
yeah, I was so ill prepared for it, but actually now, and my daughter's only 4, so I got time to catch up and repair. And honestly, I think repair is such an important part of
yeah.
life that we're gonna mess up. We're gonna mess up all over the
Mhm.
place. Internal family systems, are you familiar?
Yeah.
So Richard Schwartz, his whole movement, and so the idea of internal family systems, just to summarize it quickly, is that we have all these different parts of ourselves, and oftentimes in what looks to a psychiatrist as trauma or PTSD, or sometimes it's anxiety, depression, bipolar, schizophrenia, whatever, multiple personality disorders, even bulimia, is oftentimes that these parts have been exiled and they're not talking to each other and there's not space made for them. And in some of my own interest in parts work and learning about parts work, I actually got really more intimately connected to my 4-year-old self who like really needed attention. And one of the things that she needed was play and this
Mhm.
visualization of the cub and the lioness. And I had listened to a book, it was a couples book by Stan Tatkin, but he actually wanted to research infants, but he couldn't get couples to bring in their infants because they were too busy. So he ended up being a couples guy and he's written a lot of books about that. But he had this chapter on the importance of physical play and how
Mhm.
the visual of a lioness playing with her cub and rolling around like in The Lion King. And now when I was at this like block of how do I play? How do I play with myself? How do I play with my kids? Like what's play? And my husband's an artist, so he spends a lot of time in, it may not feel like play for him. He's going to hear this and be like, what are you talking about? But he spends a lot of time with his emotions and with feelings and with play. He's putting the paint to the paintbrush and whatnot. And I hadn't for a very long time spent any time in play. And then I had this child, and all she wants to do is play. And until I started putting some things together, I realized that, oh, she wants to roll around and figure out what her physical boundaries are. Like, oh no, you're hurting me. Oh no, I'm scared. And push it a little bit and then take it back and then repair it. And like sometimes there's a tear, but most of the time it's giggles. And I
Yeah.
think that's where the space is so important. I started painting, I started drawing, I started really in my time off, started really trying to reconnect with play. And it's made me not just a better mother, but a better friend, a better person. And I think as things like AI grow and everything becomes so technically complicated, and we see memes and whatnot that are like, gotta catch up with 20 years of AI and we need to learn all this. You need to take a course right now. The reality is like, it can help you like write a simple contract so you don't have to pay for people and you don't have to spend all this time so that you can go sit outside in nature and listen to the birds and roll around in the grass or journal or paint. So there is this duality again of let's take the most complicated technology and use it so that we can make space to be humans and be
Yes.
animals, really. Like we're not supposed to be robots. Let's let the robots be robots and let's get back in touch with being animals so we're not connected to a device 24/7. That's
Mhm.
what I think is going to help our mental health. But so call me the psychiatrist, there's the duality again. But I think most of the time we're putting together all these puzzle pieces and then we get to the end of it and it was way more simple than it was before. But like psychedelics, you can't just tell everyone to do a journey and they'll be healed. Usually their journey is like 30 years of therapy combined with relationship trauma, this, that, and the other thing. And now, oh, it's so simple. So I think we have to embrace the fact that life is super duper complicated and very simple at the same time.
Yeah.
We need to
In-
hold both, and it's a beautiful mess.
Indeed, it is, Stacy. And to circle back, particularly to women's mental health, I'm curious, in a perfect world, and you say you're not playing and you're painting. If I gave you a paintbrush and you could paint, repaint entire system of women's mental health, what would it look like?
I do think if we're looking for, let's start first like medical training, like Western. I think that we should be gathering histories when it comes to mental health histories, whether you're a psychologist or a coach or therapist or whatever you're doing in the mental health world. We should be gathering histories based on developmental milestones that women go through. I doubt the majority of psychiatrists ask when the first menstrual period was.
Mm.
Like, how was that? How did you feel about it? How was that dealt with your mother or whoever was caring for you? We're not tracking cycles very often in terms of mood and
Mhm.
energy and diet and all of that. So now that we have all these like wearables and tracking and devices and rings and this and that, why aren't we tracking hormones? Why aren't we tracking our moods and our energy and our mental clarity related to our cycles? I think that we can actually behaviorally adjust our schedules according to our cycles to make space to have our cycles and be in the intuition of each part of our cycle properly. There are weeks where I'm way more productive, and there are weeks where I need to rest, and there's a reason for it. But we
Yes.
don't build that into our schedules and into our lives. And we can. We can't always dictate our own lives, but I'm lucky that I run a business. It also comes with a ton of responsibility, but I can design that calendar. And a lot of people probably can, even just in their leisure time. Like there are weekends where they're maybe throwing parties, and then maybe every fourth weekend they should make sure they make no plans. So I think we can do it. We can do it from a medication standpoint. We have Yaz is FDA approved for PMDD, for example. We also can use antidepressants and vary the doses during periods. There's also diets that are designed to help with cycles. So I think first is knowledge. So we need to collect more data. We need to do more research on women. Women need to participate in these studies in order for us to do the research. So making it easy for women to participate in these studies for whatever reason, whether it's incentivizing them or empowering them or whatever it is, or just educating them on how important it is. Like when I was pregnant, I got a COVID vaccine and I enrolled in a study because we needed that data. So I think empowering women and people to gather more knowledge about women's bodies and women's health. And then individually, the practitioner should be gathering more in the history. And then hopefully, once we know, okay, we now have a postpartum med, like we get that word out there. I've had a lot of doctors call me because they're referring me a patient with postpartum, and I've asked if they've tried medication that now is approved for postpartum depression, and they didn't even know it existed. So I think it's really important that we're educating people about what types of treatments exist. We're improving our knowledge of women's health. And also that we just make space. We make space for people to make space, and we make space for them, and we make space for ourselves. Because I think when we do that, the answers are oftentimes much more simple. And sometimes they're a tweak of this or a tweak of that too. So we need to make sure we're relying on like the experts of whatever area it is. But more space and more attention to this issue, I think, is really the answer. Funny, you're
For
in space right now
yeah,
and your
for
background.
sure.
I guess
Yeah.
they're not going to see it, but your background looks like you're in space.
Oh, yes.
Theme of today.
Yes, for sure, Stacy, and thank you for sharing that vision, those ideas with us. For those women who may be listening and who may feel a little overwhelmed, stuck, or unheard by the current system, what is one step they can take to begin reclaiming their mental health journey?
Yeah, I think I always talk about with trauma, like it's not our fault, but it's our
Yeah.
responsibility. And I think one simple thing you can do is track your, if you're in the fertile stage of your life, and I don't want to discount the people who aren't, and I can try to speak to them in a moment, but track your cycles, how that might correlate with your mood. Because a lot of times it's just awareness that helps us feel better. Because what's crazy making is when our mood keeps changing and we don't know why, and we're chasing our tail and we can't figure it out. We try this and the other thing. But if we know, oh, these 5 days are going to be challenging, so I'm going to make my life easier on those days, it can be so empowering. So I'd say track your cycle. And by the way, what that also means is like when you get to your 40s, your cycle may change a lot, and that might mean perimenopause, and then find a doctor to talk to about it that wants to take it seriously. There's Eastern people, there's Western people, but tracking your cycle will then give you the knowledge that something's changing in your body. So making space for that. And I just want to put a shout out to women of postmenopausal age. There's so much beauty that I think our culture needs to start tapping into. And I hope that this generation of women that are more empowered can help empower the upcoming generations, because this sort of need to look young and to de-age. There's a lot of things we can do to keep ourselves healthy, but I think embracing the next stages of aging for women and making that a beautiful thing. Men can look great with salt and pepper hair and they look more refined, and like, why can't we figure that out? We're figuring it
Oh,
out. Figure it out.
yeah, I have girlfriends with even white hair and they look fabulous. Oh my God.
Fabulous. So I think getting more women in the room to talk about their wisdom and honoring them, because those cultures that don't deal with all those stressful problems related to menopause are the cultures that honor the elderly. And I think we've been missing that a lot. We're so focused on parenting properly. We're so not focused on the elderly. And now, like, finally, with psychedelic work and end of life work and death doulas and whatnot, we're starting to be interested in honoring that phase of life. But the beginning and the end, in fact, is probably the most important in all things, how things end. So I think that that's where we can be starting to focus more attention after we give women the attention we deserve. I think we can also start, for all people, giving the elderly some more attention. So I know that's not maybe what you asked, but it's becoming top of mind for me.
Yeah, and it resonates with me too, Stacy. And with regard to women, when we talk about menopause, I believe in traditional Chinese medicine, it is actually called the second spring. And if we look at other cultures also preceding the last 3 to 5,000 years, the reverence for the different aspects, the different cycles in a woman's life, if we call them maiden, mother, crone, but the reverence towards the crone, which actually comes from the crowned one, and how the crones would be also tribal leaders, their wisdom, their life experience revered, their calm and not being ruled by emotions or passions, and being able to see very clearly the bigger picture and make level decisions. So that is something where I think circling back to our roots would make a lot of sense.
Yeah. Yeah. It's exciting to think about that time becoming more honorable in our culture. It's time. It feels like it's time.
And Stacy, for those who would like to learn more about you, connect with you, also work with you, where can they find you?
Yeah, so our website's themomenthealth.com, or our Instagram is at themomenthealth, and it's probably the best way.
Excellent. I'll make sure that we also place this in the show notes. Stacy, it's been such a pleasure to connect with you and hear about the amazing work you're doing. And it's just, yeah, it infuses me with so much hope. And it's also so empowering to know that individuals such as you are out there.
Thank you so much for making space for me and making space for these conversations. And I'm really honored and grateful to have been a part of this. Thank you.
Superhumanize. Accelerated evolution.